try to maintain what we call a bit of a soft routine. So getting up at the same time in the morning, same kind of meal times and bath times and bedtimes, morning and afternoon activities and breaks. It just helps to feel like there's some structure to the day, so things are a little less chaotic and unpredictable. But if you can't keep to a routine, look, don't beat yourself up about it. Just do the best you can. It's really important to get outside, get some fresh air and exercise, stay connected with friends and family through FaceTime and those sorts of platforms. Keep the lines of communication open with your kids so they can discuss anything they might be concerned about, and maybe try a bit of relaxation and mindfulness. We have Relaxing with Birdie on the Birdie's Tree website, or they can just join in any kind of yoga, mindfulness meditation that you're doing. If you're unwell with COVID and your child doesn't really understand what's going on, explain it to them in language that suits their age. You might want to use a storybook like Birdie and the Virus to help them to understand that you're sick, but you're going to get better. Keep reassuring them that you love them, that you really want to be doing fun things with them, and that you will be able to do those fun things again in the future when you feel better. You might find that your child keeps asking you, "Are you better yet?" Just be patient. It's lovely that they care about you. And be honest with them. If they ask, why is one parent sick and the other one isn't, or why are their parents sick and other people aren't, just let them know that there's a lot of things we don't know about COVID yet, and the scientists are trying every day to find out more. We're hearing that a lot of families are struggling to cope with isolation and a sense of cabin fever. Here are some tips that might help you to cope with that. It's really important that you should feel a sense of control and that your child has some sense of agency in times that feel really quite out of control. One thing you might do is put a chart on the fridge with the number of days that you have left for quarantine, and at the end of each day your child can cross one off or put a sticker on to show that that day's done and dusted. Enlist your child in making the calendar so that they feel part of that creative expression. Creativity is actually really helpful to overcome isolation, so colouring, drawing, painting, putting on shows together. Try to stay positive, so make the most of this time that you've got together, for example by watching movies. There are lots of ideas on the internet to help with this, and I think it's really important that we understand these are extraordinary times. It's important to be able to reach out for help if you really feel that you're struggling. Here's an idea a lot of families are finding useful. Enlist your kids in making a list of things that they're looking forward to when you do get out of quarantine. Get them to draw a picture and make those plans, and make sure that you do it when the time comes. The good news is that about 80% of children will cope just fine with a stressful event like this pandemic. But there are some signs and symptoms to look out for to know if your child's not travelling quite so well. So they might become a little bit sad or withdrawn. They might get clingy or anxious, not wanting to be separated from you. They might seem to go backwards in some of the skills that they had previously acquired, like language or toileting. Sometimes they have disturbances in their eating. They might eat more or eat less, or they're sleeping. They might have trouble getting to sleep. They might have nightmares in the night. And some children become more irritable, have more tantrums, or a bit more oppositional. So all of these are normal responses to a stressful situation, but they might mean that your child just needs a little more help and support. Similarly, if you're noticing that in their play or in their conversation they've got a lot more worries and fears than they used to have, if they're washing their hands more often than they actually need to, that might be another sign that they need a little bit of help. If you have concerns about how your child is coping with the situation, there is lots of help available. You might want to reach out to 13Health or Parent Line. You might like to talk to your GP or your child health nurse, and certainly talk about the situation with friends, family, and other people you trust, like an elder, a spiritual leader, or a community leader.